Mandos, Joyce Adra.
Pakinggan natin si Secretary Francisco Duque III ng Department of Health. Kaugnay ng kasalukuyang press conference at may kaugnayan sa update sa novel coronavirus.
That we will be doing on a daily basis. About 1:30 would be the start of our press con. So the DOH, your DOH today, has informed the public that, we are informing the public that still there are no confirmed cases of the novel coronavirus 2019 and COVID in the country, as it convened the first interagency task force on emerging infectious diseases, meeting with the Departments of Foreign Affairs, local and interior government, the Justice Department, the Labor and Employment or DOLE, DOT, Tourism, the DOTR, and the Information and Communications Technology Department. Also among those who were present to discuss updates on the 2019 nCoV were representatives from attached agencies, the Philippine Overseas Employment Administration, the POEA, that is, the Overseas Workers Welfare Administration, the OWA, the Civil Aviation Authority, and the Civil Aviation Board, as well as officials from the World Health Organization, or WHO, represented by Dr. Rabi, who's no stranger to all of you. At present, there are 2,798 confirmed cases of the 2019 nCoV globally. 37 of which were reported in 11 countries outside of China. The current global case fatality rate of the 2019 nCoV is 2.9%, with all deaths recorded in China. WHO has classified the risk level for the spread of the 2019 nCoV as very high in China and high at the regional and global levels. Yesterday, it was moderate for the global spread, but it's gotten one notch higher to high risk. That is for global. DOH revealed that the DOH reveals that it is closely monitoring 22 patients under investigation or PUIs, 13 in Metro Manila, 3 in Western Visayas, 3 in Central Visayas, 1 in Mimaropa, 1 in Eastern Visayas, and 1 in Northern Mindanao. As of today, 3 of the PUIs have already been discharged as their laboratory results revealed other diseases. DOH is now awaiting results for 13 PUIs from the Research Institute for Tropical Medicine for screening and 6 PUI laboratory results from the Victorian Infectious Disease Reference Laboratory for confirmation. During the Interagency Committee meeting, members resolved and agreed to ensure support for overseas Filipinos in China, as well as comprehensive transport and quarantine plans for overseas Filipinos from Hubei province who wish to voluntarily return to the Philippines. The committee also agreed on proposing temporary restrictions on the issuance of visas for travelers from Hubei province and issuing advisories temporarily discouraging non-essential travel to China. I wish to inform our kababayans that the government will take care of you whether you choose to stay or return home. And for those who choose to return, you will be taken care of in a health facility for monitoring and further medical management. For Filipinos who wish to stay in China, DOH reiterates adherence to advisories and cooperation with public health activities being done by local authorities. DOH will ensure that all Filipinos in other countries will receive sufficient information and health support through telemedicine. I urge the public to remain vigilant Let us continue practicing good hand hygiene, observing proper cough etiquette, maintaining distance from people manifesting flu-like symptoms, cooking food properly, and adopting healthy lifestyles. So this is all for my press statement. And back to you, Yusek, Eric.
Yeah, thank you, sir. I think now maybe Dr. Rabi has some newer information from 30 minutes ago, no? Because the data we gave you is like from 30 minutes ago, and everything's been very dynamic. So, Dr. Rabi, maybe you want to give some updates from WHO.
Thank you, Eric. Yes, we have. This is data that we discussed about half an hour ago, but in between we've had a further update. This is the latest information that we've got out of China. So now the number of confirmed cases is 4,515. This is to about midnight today, last night. This is the last update we've got from the Chinese authorities. So 4,515 cases with 106 deaths. What this translates to is that the mortality rate still remains less than 3%. We have 976 reported severe cases. The severity rate is about 21% on this data. 37 cases, as the Secretary mentioned, have been confirmed in 11 countries outside of China. Our information points to the presence of confirmed cases in all provinces of China, excluding Tibet, at this point of time.
Thank you, Dr. Rabi. And also, we also got an update. As of 1:30 p.m. this afternoon, we have an additional 5 PUIs here in Metro Manila. So we have now a total of 27 persons under investigation all over the Philippines. And I would like now to turn over the microphone to Yusek Dulay from the DFA to give some remarks and to address the press.
As of today, the Chinese National Health Committee gave a briefing to all of the foreign missions, and they assured all of the foreign missions, including our embassy and consulates in China, that the government is prepared to assist our nationals. They are prepared to address this current outbreak, and they are in control. They request that our nationals remain calm, and they have already established hotlines locally, that especially for our nationals in Hubei province, of which Wuhan is the capital city. They have already established the lines there, so our embassies and consulates are in constant touch with that hotline. If there are any nationals of ours in Hubei or in Wuhan, we are ready to assist them through that hotline. As you know, the province itself is under travel restrictions, and essentially the city, Wuhan, is in lockdown as of this moment. So everything that we do in that particular zone, we have to coordinate with the Chinese authorities. But they have assured us that they are ready to address all of the concerns that any Filipino may have in that area, including the need to repatriate if they do wish to come home.
Okay, so we now open the floor for questions. Who wants to go ahead? Gerald.
Yung sa additional lang, sir, na PUI, sir.
Yes.
Ano po status ng sir? May breakdown po kanina sa Secretary?
Yeah, I thought they're all from Metro Manila, and they're still undergoing preliminary tests. Today lang sila na detect, and they're now in our hospitals.
So, papunta po ng RITM yung sample?
No, for ano pa lang, history taking pa lang to. Still samples still being collected.
Sure, all of them have a history of
Travel to Wuhan. Yes.
All 27?
All 27. Yes, all 27 have a history of travel to Wuhan.
And 3 of those 27 have been discharged from the hospital already?
3 have been discharged. First was the patient from Cebu, who was diagnosed negative for nCoV 2019 and is asymptomatic, and then 2 other patients who have now no illness, and the test showed that it was some other pathogen, some other virus, not the nCoV 2019.
But they're still considered as PUI.
Well, hindi na ngayon. From the original list of 22 PUIs, 3 have been discharged. So now we have 18 plus the 5 from today.
Sir, yung lahat na may history of travel to any place that is positive for nCoV, should they go on self-quarantine upon arriving in the Philippines, even if they don't have symptoms?
You want to answer that?
Yeah, Dr. Rabi?
If I understood your question, you're asking whether to quarantine every person who's been to a place where nCoV is positive. The numbers are very small. In many places in China and outside of China where nCoV has been confirmed, those have been in travelers who have been either in Wuhan or Hubei province. Right now, the justification is very weak for us to ask to quarantine anybody coming from all those places, because that would mean that you have to quarantine people coming from 36 countries, right? So what we are trying to do is our risk assessments are focused at minimizing disruption of social life and minimizing the risk to the community. So that's why we continue to do risk assessments. That's why we continue to change our risk assessments and update it based on the risk, based on geographical locations. At this point of time, there is no justification to quarantine anybody who comes from a city that has confirmed nCoV case. Certainly, if there is evidence of clear, extensive transmission at a community level, that could be considered. But again, we are not saying that there is justification enough for travel restrictions. We are not saying that everybody who does not have symptoms need to be quarantined, right? So it's a careful risk assessment that needs to be done. Certainly travel histories are important, and I think the Bureau of Quarantine has put in measures to take those details, particularly from travelers coming from China. That is critically important in enhancing the preparedness. Beyond that, it depends on whether somebody is symptomatic or not.
So if a person is not yet exhibiting the symptoms, but he doesn't know that he's already sick, can he pass on the virus and make other people sick during the incubation period?
So this has not yet been confirmed. We are hearing some reports from China that people could transmit the disease during the incubation phase. This has not been confirmed by WHO. We are working with a global team of experts looking closely at the information, studying the epidemiology of the disease. Right now, we cannot confirm these reports.
We have a question from this side. Yes.
Sir, sa 27 PUI, ano po mga nationalities ng sir?
I think you have the...
Yeah, iba-iba. We cannot give you naman the total list. Most of them are, of course, Chinese nationals, and there are no Filipino nationals at this time.
Tapos sir, may average ba tayo kada araw kung gano'ng kadami yung nadadagdag sa mga PUI natin?
I think we can give you the breakdown of how many have been detected per day. Pero I don't have that rate right now. Yeah. Question, yeah, at the back.
I have a question to Mr. Lu. And Chinese government has taken actions and measures. For example, to lock down the city of Wuhan, and they are going to construct a new hospital during 6 days. So, what's your comment on Chinese government's actions and measures?
We respect the decision of the Chinese government to do what it has done, and so we just have to make sure that we are to monitor the further developments as to what additional advisories the Chinese government will be issuing out. But rest assured that we are in constant communication through our Department of Foreign Affairs. In fact, I think Yusek Dulay has already, well, during our meeting, you did share with us the communications from China insofar as the travel restrictions, the lockdowns, the advisories, the reassurance that the appropriate public health advisories will be issued from time to time, and be assuring the foreign missions in China that the communications lines of communications will be open. Okay?
Yusek Dulay would like to give a comment on the briefing from the Chinese side.
The government has, the Chinese government has already set down the protocols. And being the host country, of course, each state has its own way of containing any outbreak within their jurisdiction. So as a sovereign, we respect that in the same way that we also have our own protocols. So it's an international protocol, if I understand, and it's accepted and practiced universally. So insofar as the actions taken by the Chinese government, all we can say is that we have to work within that framework because we are working with them closely to protect also our Filipino nationals in China.
Yeah, we have a question in front and then you next.
Mikael Torres on PFT. Check how many of the 300 Filipinos in Hubei province, of whom 150 are in Wuhan, have expressed intent to be repatriated, and what did the DFA do already?
Well, sir, we will know by today because as Secretary Doh has said, as the chair of the interagency task force, we came out with the decision, the task force has come out with the decision that any Filipino who wants to come home can come home, except that they will be placed under quarantine for 14 days, also for their own protection, as well as the protection of their families also. So in that respect, they are all free to go. We are now asking our missions in China to now collate the number of Filipinos as well as the names of those who would like to come home under that condition.
Yes. Follow up and then you.
China, how long will it take, for example, if I make the request, how long will it take for me to be able to go home to Manila or to wherever?
Well, we have to work within the protocols of the Chinese government. They also have what they call the rules on disease containment. So there are certain protocols that we have to observe. As you know, that's the reason why parts of China are under restriction. So the Ministry of Foreign Affairs of China has already said that they are willing to work with the Philippine government to repatriate our nationals if there is a need to repatriate them.
Yes.
Good afternoon, Mr. Undersecretary. I'm just as curious as anybody else. How do we repatriate our compatriots when there is a lockdown in Wuhan and in Hubei?
The treatment for foreign nationals obviously is different. In fact, the Americans have already repatriated some of their nationals from Wuhan. Again, it is both an administrative and logistical issue as well as a health issue that we have to address. And of course, we have to work with the Chinese authorities on this one. So it's hard to put a finger really on how fast we can do it because, again, this is two countries working together to help each other. So we have to work with them, and we hope that we can do it as quickly as possible. The scenarios that are being thrown about now is by air. There's also the option to do it by land. But of course, again, we have to take the lead from the Chinese authorities based on their own rules on the ground.
Well, Secretary, if we are to repatriate them and place them in quarantine for 14 days, what about the logistics? Who will spend for their food? What about the medicines that we're supposed to give them?
Well, we will have to spend for all of that, certainly, no doubt. As part of the quarantine measures, we will have to sustain them in all the 14 days that they are isolated.
Do you have enough budget for that?
Oh yes, we will. Yes, we know where to get the budget for that. So that's the least of our worries.
Thank you.
Yes.
Is there an estimated exact date when DOH or RMN is going to get the primer?
Well, yeah. The target was for it to arrive by middle of the week, Tuesday and Wednesday. They already identified a supplier outside of China that produces the primers, and they already got the import permit from FDA. So we believe in the next maybe 48 hours, we're going to have that test available here.
Well, we have been following up. I just spoke to the director of RITM, Dr. Celia Carlos. I've been egging her to make sure to monitor exactly where these primers are and the reagents, because we need to get hold of this so that we can already establish our own capacity to diagnose and to be able to identify that this is the novel coronavirus. If and when it does come to the country, then we did not have to send to Melbourne, Australia for confirmation, because that will again double the turnaround time.
Trish? Yeah, so when we get a case, we take samples, blood samples and then swabs from the throat and the mouth, and we check for pathogens. So we have what we call the FTD33 test. This is the fast diagnostic test for 33 different pathogens, meaning 33 most common viruses and bacteria that can cause respiratory illness. So if it's negative for that, then we do a pan-coronavirus test. A pan-coronavirus test tests for coronavirus, but it does not distinguish what coronavirus it is. So if it's positive, you know that the patient has a coronavirus, but you do not know what it is, what coronavirus. So after that, we do the test for SARS and MERS-CoV. So if it's negative for SARS and MERS-CoV, and then the FTD33 has also the 4 mild types of coronaviruses, but positive for pan-coronavirus, it means that you have a coronavirus and it's not one of the 4 common ones, and it's not SARS or MERS-CoV. So in that case, we will send that to Australia for testing to see if the coronavirus that was seen there is the nCoV 2019. So you eliminate one by one. Kasi if you see if it's Haemophilus, if it's common flu, then that's already the cause of the disease. So we eliminate everything, and then when you have a positive pan-coronavirus and you've eliminated all the other coronaviruses, that's when we send for testing to the reference lab.
Excuse me, let me just add, there have already been 4 known coronaviruses on top of the SARS-CoV and the MERS-CoV. The other 4 coronaviruses are labeled as such: the NL63, the next is OC43, and then the other one is HK, presumably Hong Kong U1. And then there is not Wuhan, U and 1. Okay, and then the other one is human coronavirus 12232. I'll check on that, the details of that. Now, you must understand that a lot of pathogens are many similar when in terms of the symptomatology, the clinical signs and symptoms in patients, and they're mostly viral. They're you have the alpha influenza virus. If you remember the pandemic AH1N1 of 2009, can you please raise your hands here if you can still recall the pandemic AH1N1? And nobody's raising your hands, so I must have really aged because that was 10 years ago, 11 years ago. So you were probably kids then. We had terrible pandemic AH1N1. Okay, so that's the alpha influenza. Then you have the beta influenza, many other pathogens that can give rise to overlapping clinical signs and symptoms. Now, let me just explain to you that these pathogens are mostly self-limiting. Some don't have, like the coronaviruses, there is no known treatment, no vaccine, no antivirals available to treat them. And they're, for the most part, symptomatic treatment is the intervention. and then they're self-limiting. However, let me just emphasize the fact that the elderly population is the most vulnerable population to these pathogens. If you look at the case fatality rate in now, the latest report of 4,515 cases reported as of 12 midnight of June 27, right? That's 106. It's now 2.3%, down from 2.9%. It's probably about 20% less than what it was yesterday. Over the past 2 weeks, it's been hovering 2.7, 2.9, 2.6, 2.9, 2.3, the latest. So hopefully this thing doesn't kick up and assume, hopefully not, assume the death rate.
Mga kasama si DOH Secretary Duque, ito'y kaugnay sa press conference na ipinatawag ng Department of Health, katuwang ang iba pa hong mga tanggapan kaugnay sa latest update para po sa ating mga kababayan sa Wuhan coronavirus or novel coronavirus. Sa mga pinakaimportanteng detalye lamang po na iniwan ng Department of Health ngayon lamang, binabanggit ho ng kalihim na nasa 27 persons under investigation meron ngayon sa buong bansa. Ibig sabihin, iniimbestigahan ng DOH sa buong bansa, ulitin natin, 27 persons under investigation. At kinaramihan ho dyan galing sa Metro Manila, Western Visayas, Central Visayas, Mimaropa, Eastern Visayas at Northern Mindanao. At ito po'y mga Chinese at may history na pumunta or galing sa Wuhan, China. Balikan natin ang press conference ng Department of Health.
The epidemic of misinformation, which can be more viral than the virus that we are all guarding against.
Yes, from the back. Later, we give you back. Yeah.
Sir, Leah Fernandez, CB5. Sir, what is the recommended protocol of the interagency in dealing with Chinese nationals who want to enter the country? Because earlier, the Bureau of Immigration said that they will be suspending the visa upon arrivals, but then they later clarified that it will only apply to those who are in group tour.
As of, if I'm not mistaken, 3 days ago, the Chinese government already imposed a travel ban for its nationals from China, leaving China, tour groups. So essentially, the Chinese authorities have already stopped tour groups from leaving China. However, for business travelers as well as individual travelers, it's still open. So they can continue to apply. However, it's been decided already by the interagency task force to come up with certain temporary measures for health reasons, and we will be coming out with those advisories later on. But like other countries that have imposed the same travel restrictions, the interagency task force has also deemed it necessary to impose certain travel restrictions for travelers from China. But again, you have to understand that the primary consideration for any travel restriction from China is really the health concerns of our government for incoming tourists or visitors from China.
Sir, just a follow-up. May mga dumaong po kasi na cruise ship from China, I think, and from Hong Kong dito sa Manila, and one reportedly in Subic. So how do we address that?
That is already an immigration quarantine issue, so we'll probably pass it on to the
well, we have a report from the Bureau of Quarantine. No? So this particular ship, I think was supposed to house 4,000 tourists, but mukhang nag-cancel most of them, and there are now only 780 passengers. Before the ship left Hong Kong, all the passengers were screened, and on board we have a quarantine officer also checking the patients, the passengers, checking the passengers, and everybody's healthy. When they get down in Subic, we also have another quarantine station there to check again before they're getting down. And I think they're only scheduled to stay in Subic for like 6 to 10 hours. No? So at this point, the quarantine offices are doing all they can, and we see naman no health hazard at this time. Yes, Aiko.
By the way, let me just add, that ship is coming tomorrow in the morning. It's going to dock there and then leave at 4 p.m. But there are new developments. I don't know if you are aware that there's been a threat of a rally to be staged by some groups in Subic, led, I heard, by the mayor, what's his name? I forget the name. So that's something else. That's a new development that we cannot comment at the moment. We leave it to the Subic Bay Authority to do what is appropriate, bearing in mind the safety of people, because you don't know if there are rallies like that, what can happen. The passengers, there are also Filipinos, by the way, 15 Filipinos in the ship that's docking tomorrow. But the different nationalities, about 10 different nationalities. But by and large, the PRC Chinese, about 350 plus, and about nearly equivalent number from Hong Kong. Okay, so 15 Filipinos are aboard that ship.
Aiko and then Apples.
Yes, the quarantine plan will be made known to the volunteer returnees. Okay, all the details of the plan will be disclosed to them, and we are now arranging one place where we can quarantine all of them for ease of management, rather than assigning them to different facilities. And I have been in touch with the Field Implementation and Coordination Team, Assistant Secretary Abdullah Dumama, to talk to the LGU. I'm not at liberty to tell you where at this point, but suffice it to say that preparations are underway precisely to support the quarantine plan that will be implemented once the volunteer returnees would formalize their request to be repatriated.
Apples.
That's a very difficult question. But the consensus is that the incubation period is anywhere from 10 to 14 days. Now, there has been some talks of possibly spreading the virus by an individual who has not manifested any signs or symptoms. But there has been no evidence to back it up. According to the WHO, up to this point, there is no clear evidence to show that such may happen.
So we have time for 2 more questions. At the back, and then Tina.
Yung nabagin yung sex ng primer, nalalapit na po natin makita, by how much time po malireduce yung results, yung paghihintay sa results, pag hawak na natin yung primer?
Well, ang matatanggal kasi yung ating travel time, no, referral time, because it's taking us some time. Every time we need to send a specimen to Australia, it takes us about 2 days before we arrange it with a courier And then for the, syempre yung government ng Australia, because we're transporting potentially infectious materials, no? So medyo matagal yung clearance. So that would cut it by at least 2 to 3 days.
Follow-up lang po. Estimate budget po na kailangan for all these preparations for ENCOM. How much will DOH allocate?
We don't have the figures at the moment because, like I said, that's the least of our concern. What is important is to prioritize the facilitation of our people in Wuhan, China, who have expressed the wish or the desire to be repatriated. So we'll talk about budgetary matters later.
Okay. Last question, Dina.
Sir, yung mga magpaparepatriate, is there an assurance from China that they will be able to go back to their work? Also, if one of the PUIs tests positive for NCOV, may isang place lang po bang pagdadalan sa kanila dito sa atin?
Well, actually, all the PUIs now are admitted and in isolation, no? So, not in one place. But if they're positive, then they will stay in that facility until they recover and we're able to clear them for discharge.
Sir, yung sale ng surgical masks, marami yung wala na mag-claim na surgical masks because a lot of people have either reserved a lot and can't buy anymore or talagang wala na nabibenta yung mga pharmacy.
Well, no, at FDA, we're trying to contact the suppliers because these are registered suppliers for medical devices, no? And they promised to mobilize supplies, but you have to in demand worldwide. So if the supplies are going around, all countries are asking for them. But we've already contacted the suppliers to bring in supplies into the Philippines. But we're asking also the public to be more choosy naman. Not everybody needs, for example, an N95 masks. N95 masks and gloves are only recommended for people who are taking care of sick people and who are in contact or those who are under investigation. For everybody else, for the general public, regular surgical face masks are useful, but we want to reserve yung equipment natin, yung N95 natin, for those who really need it.
So yung mga frontliners nyo, okay naman yung protection nila, the hospitals are prepared just in case?
Oh yes, that's one of the first order of the day when we heighten our infection control, our case management capacities in the hospitals. So in the pecking order, they are the first ones to be provided with PPEs or the personal protective equipment. So that means the goggles, the headgear, the mask, the gloves, the gowns or the aprons, and including the shoe guard. So they will have to be the first ones because they need to be protected while giving care to those who are infected in case it does come in. So, yes.
Last thing I don't think so, no. Not in my list. You haven't asked a question, please.
Secretary, you said July. Sir, may we know po the population of Illinois po sa Hubei?
Hubei province, our numbers now is 300, a little over 300 for the province. For Wuhan, it's around 150, thereabouts. As you know, these exact figures are really hard to come by because they don't check in with our embassy or consulate. When a Filipino OFW arrives in the country to work, they don't check in. The only people who will really have the numbers would be the immigration department of the host country. So I just want that clear because sometimes there's an expectation that their embassies and consulates have an accurate number. We cannot do that because not all Filipinos check in or let us know that they are in country. So yun lang. But we are keeping tabs, and now we have thrown the numbers because we are planning to repatriate all those Filipinos who can. That's the order of the President. Let's bring home everyone and bring home everyone safely. The only condition now in this repatriation is that because of the interagency task force resolution, they will have to be quarantined, especially those repatriated from Wuhan and Hubei province. Thank you.
Dr. Rabi?
Just a clarification because I'm looking around the room and many of you are in masks.
To protect us from flu.
Yes, so our advice was if you have signs and symptoms of a respiratory infection, to wear masks. Normal people going about their normal work don't need to wear surgical masks or N95 masks. If you are visiting somebody in a healthcare facility where there is a concentration of people with respiratory infections, or you're visiting a crowded place, a wet market, you may want to wear a mask, but you don't need to routinely wear masks from morning till evening. I'm just trying to reassure you that you don't face such a high risk that you need to wear a mask as you come for any press conference given by the Secretary of Health.
We are not wearing masks, no, as you can see. One short question from Trish. Yes, 27, 3 have been discharged. Ay, hindi ko alam kung alin sa kanila, pero dalawa the discharge. Aiko, and then last question. Hindi, talagang last na to. Laging first and start, lagi kang first and last. Sige, Aiko. Short question, please.
Well, you cannot control the flow of such information. You know, in the era of social media, that is par for the course. But what I would like to appeal the media partners with us today is to really be the purveyors of evidence-based or science-based pieces of information. And there's no, because again, the DOH in partnership with the WHO should be the repository of all of this information that will allow people to appreciate and understand this evolving issue of N29 and COVID. So, sa amin lang po kayo makikinig ang DOH. Wala na po kayong dapat pakinggan dahil kapag inyo pong pinakinggan ang iba sa labas ng DOH, ay malamang wala pong batayan, wala pong malinaw na basihan, at bagkus ito po ay magdudulot ng pangamba, magdudulot ng kalituhan, magdudulot ng kaguluhan. At hindi po ito maganda para sa ating lipunan, at this will not help stabilize a situation that already is really quite challenging at the moment. And so again, I reiterate that lahat po ng manggagaling sa DOH ay amin pong ipararating sa inyo, at sana ito po ang mananaig. Huwag pong patulan kung ano-ano po yung mga nasasabat ninyong mga impormasyon, ay dapat maging mapanuri tayo. We have to be discriminating, and we should at least verify or ask questions to validate saan ba galing to. For example, you see this video of people collapsing, falling flat on their faces purportedly because of N2 and COVID. I mean, like, meron bang date ito? Kailan ba ito kinuha? For all you know, this is only a fabrication. You know, it's very easy now with the technology. They can make something not real. Okay? So, let's not sucker in to those fake news. this will not serve any good for society and for all.
Joyce?
Yes, kasamang Lord, sa kinupirma ni Dr. Rabindra Abayasing ng World Health Organization na umaabot na sa 4,515 ang kabuang kaso ng novel coronavirus as of January 27, 12 midnight. Ay ang 106 na ang namatay sa China at sa ngayon ay merong 976 severe cases. Kinupirma naman ni Health Secretary o ni Health Undersecretary Eric Budico na 27 ngayon ang persons under investigation at sila ay pawang mula sa Wuhan, China o may history ng biyahe sa Wuhan. Dilinaw naman ni Health Secretary Francisco Duque na 3 sa 27 na persons under investigation ang nakalabas na ng ospital. Pinaalalahan naman ni Duque ang mga Pinoy sa China na panatilin ang tamang hygiene at sumunod sa abiso ng mga otoridad doon. Pinayawan din ni Duque ang publiko na iwasan na magtungo ng China kung wala naman silang mahalagang pakay doon. Maaari rin ang tulungan ng DOH ang mga Pinoy sa China na mga kailangan ng tulong sa pamamagitan ng telemedicine. Pinayawan din ni Secretary Duque ang publiko na sa kanila o sa DOH lamang makinig at iwasan na maniwala sa mga post sa social media. Pinayak naman ni Foreign Affairs Undersecretary Iwi Gulay handa ang Department of Foreign Affairs na tulungan na makauwi ng Pilipinas ang mga Pinoy na nasa Wuhan. Pero kailangan muna nilang sumailalim sa 14 na quarantine. Ilinaw din ng DFA sa ngayon ay wala pang Pinoy sa abroad ang positibo sa novel coronavirus. Mula dito sa Department of Health, Radyo Mandos, Joyce Poliandas Adra, Tatak Armin, DCXL 558.
Maraming salamat XL Radyo Mandos Joyce Adra. Press conference ng Department of Health update sa ating mga kababayan kaugnay po sa coronavirus, novel or Wuhan coronavirus. Mga kasama, i-like sa Facebook ang RMN DZXL 558 Manila. Ako si Radyo Man Lourdes Escaros.
DZXL News Break.
Oras po natin 2:26.
That time check was brought to you by ACS Manufacturing Corporation.